Greetings. So we have a couple of people getting settled here. My name is Ben Bush. I'm a physician with ViveWell Health here, and thanks for coming to our in-person and live webinar event on detox. There's a lot of discussion on detox in in popular culture, and it's a very much a buzzword on I'm detoxing in January. It becomes an event, right? And one of the things that we want to talk about is, so what is detoxing? What does this mean? And is there a strategy with people? So I'm going to be joined by, we have a functional medicine registered dietitian, Satya Williams. And we also have a master nutritionist, Nikki Burnett. Nikki had some car trouble, so she's actually en route and she's on her way. She should be arriving shortly in the next 10 minutes or so, but we're going to go ahead and get started without her. So when we talk about detox, let me go ahead and get this started. I'm going to share my screen. When we talk about detox, here, let me get over to here. Here we are, and the slideshow. Can we see this okay? Perfect. So when we think about detox, we want to consider what cells actually have to do, right? Cells have to eat, they have to make energy, they have to do their job, whether that's seeing or being an elbow or being a kidney, whatever it is they're doing, right? And then they have to get rid of their waste. Now, when we think about how to get rid of the waste, this is what the challenging issue is for people, because your body has to get rid of a toxin or whatever waste it is. And so we want to think biologically, like, what does this even mean? And there's three buckets of toxins that we really think about here at this practice. So there's environmental toxins. These are the pesticides, the herbicides, the diesel exhaust, in that gross truck up there. It's the microplastics in your water bottle, right? Or we recently had a patient who had volatile organic compounds, VOCs, that they were getting in their water in Lakewood, right? And so they were, right? And they wrote to the town of Lakewood, and they said, well, actually, there's no published guidance on upper limits of normal, and so we don't have to do anything about those. So there's these environmental toxins that you may or may not know you're being exposed to. And then there's these toxic metals, right? Toxic metals, well, we know that there's cadmium in our dark chocolate, and we recently saw the published article on how, well, they're finding lead in a lot of the low-grade protein powders, right? Last year, there was a scandal about lead in cinnamon that they were selling in the baby's applesauce pouches, right? And so we knew there was cadmium in lipstick and mercury in the batteries and in the salmon, and right, the list goes on. Okay, so toxic metals are the second bucket. And then the third bucket is what we like to consider biofilms. Biofilms being, Lyme disease that just won't go away, or a lingering bacterial infection that can stay inside your body and you have a hard time getting rid of it, right? Or these chronic infections, Epstein-Barr, HH6, or Lyme disease, right? And so there's these toxins that people just can't get rid of. And so when we think about this, we want to think about biologically that there are these systems, right? Your adrenal, your liver, your neurological, immune, all this stuff that's in, the microbiome, all this stuff is implicated and part of what's going on. But then there's these stressors that are affecting our abilities. So whether it's infections or electromagnetic fields or chemicals and toxins, and sure, even just our emotional response to stress can affect your physiology. Injuries, allergies, you name it. Even pain, chronic pain, can affect people in a way where their physiology is changed. And that can affect how we eliminate toxins and really have our body operate optimally. So what we'd like to discuss today is why should we focus on detox? And at this point, I'd like to go ahead and have Satya get started. And why don't you come around and you can talk, and then we'll introduce Nikki when she arrives as well. But you can go ahead and get started.
Thank you, Dr. Bush.
Satya.
You know, when I heard Dr. Bush was open up ViveWell, I knew that I had met the right guy at the right time. Maybe like some of you patients that are here today, availing yourself to these therapies. And I really like this topic because it pertains to all of us. So Dr. Bush did a great job going over some of the chemicals and things that we're exposed to on a daily basis. And by the way, my name is Satya Williams. I'm a registered dietitian. Been in Colorado. You could almost say I'm a native, maybe more than some who aren't born here. I was born in North Carolina, came to Denver when I was about 6th grade level, and I've been here ever since. University of Northern Colorado, graduated with my registered dietitian, nutritional science degree, did my internship, started at Denver Health, and here I am. I came and decided to join Dr. Bush because when I got board certified in functional medicine, I realized that we're all affected by these things and that the conventional medical system isn't always treating some of the things that are happening to our bodies. And exposure to chemicals in our food, water, and air, Dr. Bush went over some, PFAS in the water. My gosh, that flame retardant, it seeps into the aquifers, it's everywhere. We all know there's metals in the water, there's all kinds of stuff, and there's no regulation really on these things. You know, it's not just the water we're drinking, it's the air we're breathing. It's the food we're putting in our mouths every day. It's the things we're putting our food into so that we can eat later. I heard the other day, Bush talked about it just briefly. I want to quantify that they estimate each of us is eating about a credit card worth of plastic every day. And I just heard a study out of France. Microplastics. They're in the ocean, right? We all knew that. They're also in our organs. They did a study, and they're linking them with chronic disease. And so in this slide, you can see kind of a slide there, slow genetics. Some people don't detoxify. We're not all the same. We have increased toxin exposure. Our genetics might be a little bit off. Maybe they're good. Even if they're good, your liver has a big job. Poor elimination, constipation, lack of daily sweating. These are the routes that these toxins are brought out of the system. Chronic stress, cortisol. Cortisol in and of its own will increase, if it's unmitigated, it will increase inflammation in your body, which is akin to a toxin. Chronic inflammation, chronic disease, no movement anymore. Nobody's sleeping right anymore either. The most anti-inflammatory thing you do every day is sleep. If you're not sleeping right, you have a harder time with these things. So you have exogenous metals, chemicals, plastics, viruses, biofilms. Isn't that interesting? I remember learning about these for the first time, and these microbials can rob us of minerals, which are microscopic metals, and they build little like castles out of them and hide in them. It's kind of scary and fascinating at the same time. And of course, we have endogenous, and our other nutritionist has just arrived. Dr. Bush brought up that, chemical psychogenic toxins. Your liver has to process emotions, cortisol, that are connected to neurotransmitters. And these are needed for elimination as well. They can recirculate in the body, just like hormones, and lead to problems. So the liver and the gallbladder system are particularly relevant here. They're the organs of detoxification. The key ones, of course, diet has a lot to do it. A lot of us are doing harm eating things that may be causing inflammation in our bodies, that may be fueling microbes. Maybe we're not digesting things right. Hippocrates, father of medicine. Ever heard of that guy? My hero. The root of all disease is in the gut. That was not an accidental statement. We see it all the time with a lot of people. Intestinal microbial balance, the microbiome. When you think of detoxification, you're also thinking of foods that your body is not digesting well, supporting function, and then what is above is reflected below. So the microbiome, that's what takes advantage of things we're not digesting. Takes advantage, well, they're not all good guys. There's good guys and bad guys. If you have had antibiotics a lot, maybe there's more bad guys. Viruses, COVID, it's like an antibiotic in your system. So that's necessary for detoxification as well. They call it an allostatic load. All chronic disease, I just want to focus on that first bullet. Inflammation, you see toxins, they call it an allostatic load, equals chronic inflammation. And then look at the first bullet. What is chronic inflammation related to? It's the common language of all chronic disease. And I have other things listed below. Allergies, autoimmune conditions are on the rise. Even little things related to, headaches, little things, right? That's not so little, depending if you've ever had those, very debilitating. So phase 1 and phase 2 detoxification, they occur in the liver system. Your liver first has to identify a toxin, mobilize it. They're usually hidden in bones and in fat and an intracellular matrix where they're just kind of stashed. Your body tries to separate them away from the serum water solubility so they don't engage. So when the liver phase 1 kicks in, it mobilizes toxin, pulls them out of fat, bone. We want it, but only if we have appropriate phase 2, because when the toxin is mobilized, it becomes more dangerous. It now is water soluble. It can interact with tissues. So phase 2 has to be supported often and readily engaging with the amount of toxin accumulation. They need a lot of support often. Phase 2 will render that toxic molecule, which is now interacting with the system and causing damage. Phase 2, I like to make like a metaphor. It's like putting an anchor on it so that it goes through the bile to the feces, intestines, and out down the back door. That's what phase 2 does. Yes.
So you have to have phase 1 optimized in order for phase 2.
You need them both optimized, especially. Yeah, and certain people, we have ways of looking genetically at slow detoxifiers, and we see hallmarks in laboratory data that can also guide us. People, sometimes they have a food sensitivity or an allergy, and it's amazing. Often the people know of this, they've eliminated, but whenever I hear that, and the person's been alive for a while, I tell them, let's look more. Because in my world, when I see a food sensitivity, food that we're not digesting, usually by the time we know of one, the leaky gut has already been mobilized, inflammation does that. Something is lacking in the digestion, something has waned. It's very common, especially as we age, especially as we're impacted by these accumulation of toxins. So we have to identify and take them out so that we can stop the inflammatory process. A lot of folks had a lot harder time with COVID than they needed to because they had low-grade inflammation, because microbials were robbing them of nutrients, all of these factors. So detoxification is a way of increasing the health of your body, eliminating the toxins, you see conditions. Their symptomology is often rolled back when this happens. If you're working with a targeted program. So in phase 2, you can now expel this toxic molecule from your body. Methylation will create a situation where it can no longer interact with the tissues. And so it's going through the body. Now, if your detox elimination channels are not operating at 110%, we're going to want to support those too. Bile, bowel movement, urination, sweating, and even detox through the lungs. They're all important. Dr. Bush has some incredible novel therapies to advance this here in practice. Chelation, ozone therapies, EBU. I have a lot of folks that are working on detoxification that are also working on these elimination processes with Dr. Bush, and they feel better even as they're achieving a higher level of health through the detoxification. Detoxification, when it's necessary, can be a very engaging program for complete healing. But as my other colleague will tell you, and I fully agree, detoxification also occurs on a day-by-day basis, especially once you've achieved that healing you're looking for. Now we want to maintain. And with that in mind, I'd love to introduce to you a brilliant nutritionist here at ViveWell. Please welcome Nikki.
Thank you. Sorry, everybody. I was late. I got into my car and all of my lights on my dashboard came on. And so what it says is, go to your Toyota dealership. I was like, what do I do with this? So anyway, I apologize for being a little bit late. So, and I didn't hear all of the fun things, but I love detoxification.
Oh, wait. It's videoing you.
Oh, well, then I guess I just get to be short. Let's see what this. Okay. Detox is one of those things that, you know, where I'm going here. As Satya said,
We want to talk about PC though. There you go.
oh, I thought that was yours.
That's okay. You can talk about PC. Get started.
Okay. So it is a daily basis. You know, we have this so often, this thought process. I've been there too, where we have this thought where we need to do a detox, or we need to do a cleanse, or we need to, you know, do my yearly, you know, vegan diet, or whatever it is, right? You know, we have all of these fads and things, you know, about around detox, but really we need to understand that the body is constantly detoxing, and we need to allow it to be to promote the detox processes so we can function normally, right? And so I'll get to PC in just a minute, please. Okay. So through what I find the most interesting about food itself is we see food as, you know, it's fun, or we can't figure out why it's hurting us. You know, why does my belly hurt when I eat, or why do I feel amazing, or why do I have brain fog? But if we take food down to its basics, what it is, it's communication. The nutrients in food are what allow the body to understand what it's supposed to do, which means it has to function. It has to use those nutrients to function properly. So if we're eating food that is full of nutrition, it's, you know, high in antioxidant capacity, it's, you know, got its vitamins and its minerals, good healthy fats, not your McDonald's fats and your vegetable fats and that kind of thing, then the body has the ability to detoxify, right? So we have to keep our own unique health in check and understand our own, you know, the way that we detoxify. But sorry, I feel like I'm getting a little befuddled for a second here. But if we're eating the food that's good and healthy for us, then the body's should work properly. if we're eating foods from McDonald's, right? If we're eating foods that don't benefit us, then the body's going to start sending out red signals, right? And then we got to call Dr. Ben because we don't understand what's going on. And we're trying to figure out why our body is not, it's angry at us, or we have an autoimmune condition, or whatever the case may be. So if we're going through, if we were to go back to things like phosphatidylcholine is super important in detoxification because it helps in cellular repair. It helps in, intestinal integrity and protecting the cellular, the intestinal cellular lining. It helps with cognitive function. So it's supportive of the brain. And so we can get phosphatidylcholine through eggs, through organ meats, but we can also get it in supplement form, and we can get it in IV form. So if we're getting it in IV form, it's going straight into the bloodstream. So it can go in and can do its job. With, moving into other supportive nutrients, right? B vitamins, amino acids. I had a client today who is a vegetarian and a vegan, and some of you might be, but it's really hard to get the robust amount of amino acids that we need in order for our detoxification processes to function properly. So knowing that if you are vegetarian or vegan, making sure you're taking in those amino acids. We've got perfect aminos, right? That's a great form of amino acids if you're not getting enough protein in order to, for one, support detoxification, but we're also supporting muscle health. We're also supporting neurological health and neurotransmitters. So amino acids are super important. And then beyond that, so it helps, we have to make sure that we're eating in order to, that we have good bile production. Bile is really important in detoxification and breaking down fats. We can get kind of sluggish if we are not eating well, and if we're not, working on daily detoxification, if we're not hydrating. Hydration, oh my goodness, we can drink a lot of water. If our cells aren't taking up the water, then we're still going to be dehydrated. So why is that? We can have cellular dysfunction and mitochondrial dysfunction that doesn't allow for us to hydrate the way that we should. So making sure that, it sounds like it's a lot, but it is, again, this daily practice of eating well, feeling as well as we can, moving, right? Moving is going to help with hydration. Moving is going to help with detoxification, sweating, which is going to get me into sauna here in just a second. But one of the things I want to make sure we also think about is gut health. If we are eating and we're eating well, but our gut is not in check, and we're not absorbing our nutrients, then these processes are going to be off. Detoxification is going to be off. It's not going to work as well as we would hope it would. So one of the things that we can do, there are lots of, besides the hydration and the daily movement, sweating. Sweating is really important to helping the body to detoxify. So beyond that, though, is infrared sauna. And excuse me, we can have, our regular steam saunas. We can have far infrared sauna. We can have full spectrum infrared sauna. Not a huge fan of steam sauna, only because we don't know what it is that is in that steam. So I'm super careful about that kind of stuff, right? If it's water that is full of chlorine and fluoride, and you've got a steam, you're in your sauna full of steam, what is that going to do, right? We want to make sure that it needs to be as clean as possible. But then we have far infrared sauna, and there's so much amazing data on both far infrared as well as full spectrum. Far infrared is really great for full-on detox. If you just need to detox, that's what it's great for. My favorite is full spectrum infrared sauna, because full spectrum infrared sauna can help with stress release. It can help with collagen production. It can help with inflammatory markers. It can help with optimizing athletic recovery. It can help with mycotoxins and environmental toxins and pesticides and herbicides, right? It's wide ranging what the benefits of full spectrum infrared sauna are. And I put some of these stats together because when I first saw this, and this is bigger than the one that I saw originally, but to me, these numbers are so staggering that I just thought I have to have one of these, and I don't have one yet, but I want to have one. But 65% lower risk of Alzheimer's disease and dementia if you are in a sauna 3 to 5 times a week. That's huge. This is so big. 50% reduction in cardiovascular related deaths. You can burn many more calories, which is going to reduce visceral fat. We've got 32% reduction in CRP, which is an inflammatory marker. It's really important that we keep it in line. I didn't realize it was back there. Let's see. So I don't need to read through these, but I'm glad you can see them, because when we're looking at things like autoimmune conditions, why are we struggling with autoimmune conditions so often? Or, other chronic conditions that we, need to come see Dr. Ben about. We have toxins in our environment. We have xenoestrogens. These are probably things already that Satya already talked about, but we are so inundated by these toxins. It's like 80,000 toxins that are in our environment and in our world that have not been tested. I mean, it's insanity. And our body doesn't, if we don't give it the tools it needs, it's going to be a lot harder for it to do its job. And so by doing things like these full spectrum infrared sauna, it's going to just push it so much quicker than if we're just trying to do it by just food and just lifestyle and that kind of thing. All super important, but doing these therapies, Satya was hitting on these a few minutes ago, doing some of these therapies that can push things further, faster, help the body eliminate the toxins faster, allow the body to work better by giving it the nutrients that it needs, by IV straight into the bloodstream. These things are really huge for people who are struggling, or if you're just looking to optimize. Fasting.
Opposite of, I think.
It is. So I'm going to let you take those on, but I will talk about fasting. I'll start talking about fasting, and then I'm going to let you finish talking about fasting, since you have such interesting experience with it. Fasting is biblical, right? Fasting is this amazing way to create cellular turnover, essentially, to kind of help it to dump the junk that gets all trapped in the cells. So whether it is, thank you, whether it is intermittent fasting, which can be great for some people, and we can do intermittent fasting, which is a 12 hours on, 12 hours off. We can do intermittent fasting as much as 16 or 18 feeding schedule. Or if we want to, some people will say 36 hours, right? If you're doing a 36-hour fast, you start to hit that point of cellular turnover, of autophagy, start dumping. And we can go even further than that. But I think that it's important to understand the capacity and the capability of the person, the health status, what you can do, and what your goals are. And then make sure you're talking to a professional, because you want to make sure that you are doing it properly in a manner that actually is going to be beneficial and not detrimental. If you're in a really extreme place of dysfunction and you try to do even a 36-hour fast, that might go the wrong way for you. So we want to make sure that you're doing it in a manner that makes sense, but it can be really helpful, really beneficial for a lot of people. It works. Intermittent fasting is really great for men. I like to tell women that when it comes to intermittent fasting, we want to be more careful. It can be a little harder on the thyroid. We tend to have more thyroid dysfunction than men do, but it is a great way to, excuse me, to Sharpen focus, right? Support detoxification, support longevity. It's a great way to support longevity. And I think with that, I'm going to let you finish up.
Awesome.
Okay. Thanks, Jan.
So just on the the tail note, I completed a 14-day fast recently, and it was recommended to me, I want to say 2 years ago. Two of my mentors individually told me, you might want to try a 14-day fast. And I did not necessarily want to do that. And it was certainly daunting. And I really wasn't interested in doing coffee enemas, if I'm going to be honest. But the more I thought about it and I was researching on fasting, I thought, this is something that I think is transformative. And so I may have mentioned this to some of you, and I've mentioned it in passing, and people were astonished that I would go 14 days without eating. And so I published a prolonged paper, and I've updated this. This is a decades-old protocol where there's a tincture that we make with some syrups and lemon and cayenne and such that uses to quench your hunger. And so therefore there's some minerals and some fuel for you. And we've upgraded this really in 2 flavors. One for the average person who's like, I think I could do that. I'm a little overweight, maybe some fatigue or something like that. And so this is a kind of the upgraded protocol that I think is remarkable. I had some hunger at first, and I might have been a little crabby. My wife was telling me that I stunk. I was like smelling, and I was like, all these toxins were coming out of me. My breath was bad. My kids didn't like being around me. It was like I was burning through stuff. But then I had some breakthroughs where I was like waking up at night sweating, right? And by day 7, I actually did an EBU procedure here. We'll get to EBU later, but that evening, I actually had like severe, almost like a viral syndrome where you're like, your skin hurts, your hair hurts, I don't feel good. I went and took a hot bath, and I actually woke up around 11 o'clock at night, and I was like better. And so for the next 7 days of not eating, I actually was experiencing a profound amount of energy. And so I had some sort of inversion reaction, a healing reaction in my body. And then as I reincorporated food, I'm proud to say now that even though I've been doing all this stuff, the medicine stuff, and I've shared my story about my own illnesses, I still was, around 85, 90% better, right? And what I'm proud to say now is it took a 14-day fast to get me energy levels that I literally haven't experienced for more than 10 to 15 years. I feel like I'm in my 30s again. So it's a fascinating tool. So that's the Detox Fast protocol that we'll be sharing with you. We'll be sending this out afterwards. There is an upgraded version. We have a number of our patients who are experiencing chronic Epstein-Barr or mycotoxin or long COVID or some of these weird things that we're still even trying to figure out what's going on with some people. And so I've included some of the ancient and well-established homeopathic remedies like cat's claw or artemisinin or olive leaf and some of the other things. But there's strategy and proven dosages that I put on there for people. And there's links to all the supplements and stuff to make sure you don't waste muscle or other things. So that'll be sent out afterwards. Just because it's something you can do at home, and it's not particularly expensive, and it's not an IV in your arm, but I think it's transformative when combined and done safely. So, we've talked about nutrition and we've talked about, sauna and other stuff, but, what about the good stuff? Go ahead. What about medical things?
You did a 14-day fast and you had nothing but water.
That's not true. I had a 14-day fast and I supplemented with some nutrients, and then there was a syrup blend that had some carbs in it, but I spent most of the time in keto. That's correct. Yeah.
So it's a liquid.
It was a liquid fast. I lost 14 pounds. Yep.
Like, is it coming back? Are you getting that fun or?
No, I still exercised. So
Oh, you did?
yeah, and I have a pretty good sized document to kind of explain my experience and healing reactions and the strategy for it. So this is a safe, effective. Well, I don't want to sound like the FDA. It's a proven strategy that I would feel comfortable putting my parents or even my sickest patients on. To put them in a position where they're protected physiologically, but burning off the bad stuff. Which is why, I probably spent 50 hours making sure that this is something that I could recommend to anybody.
Just a quick question on your experience on your 14-day fast. Did you also incorporate prebiotic fiber to help keep the good gut microbes happy while you were fasting?
I did discuss it. Psyllium husk would be the only thing that I would add, but we were using like essential amino acids and some other things, which are all described pretty accurately. So moving on to, and we can entertain some questions afterwards. I just want to rip through some of these things to kind of get us back on track. So when we think about the medical strategy, right, we want to think about basically aging and all these maladies that we have, whether it's hypertension or arthritis or obesity. It's a problem of oxygen utilization, right, of our metabolism. And so when we have excess free radical production, right, we get degenerative illnesses, this oxidative stress. And many of you have heard me talk about this ad nauseum. And so when we see, it can be in the mitochondria or around the mitochondria. And so when we don't make as much energy, right, we can't repair things, and we don't have the fun that we want to, right, when it boils down to it. What I'd like to talk first about is ozone therapy. Ozone is a therapeutic stress, much like push-ups, right? How we push your body and it comes back stronger. And so what I'm going to do is show you how ozone therapy works. And then we're going to go into chelation therapy, the process of removing some of these toxic metals. So here's a great diagram that, and some of these are taken from other presentations that some of my mentors have given us. But right now you see that, you have a cell and oxygen needs to be circulated to the cells. And we use fat and glucose as fuel, and you need stuff like thyroid and cortisol and these other nutrients and hormones, but everything gets brought to a cell and it gets, well, we burn fuel, right? There's this process of bringing things together. And so this OU is oxygen utilization. And so out comes energy. But of course, these free radicals are formed. And, well, if you're not making that much energy, what's happening then? So we get people who are short of breath and they really can't work out that much. And then there are problems with temperature, and they get chronic illnesses, and they're weak and tired, and they get painful conditions. So it's kind of a vicious cycle, right? If our mitochondria aren't actually burning and making enough energy, they're not really utilizing oxygen all that well. Kind of like when you drive a car and your clutch doesn't work as well. It's like you're not getting all the power to the wheels. So you get, on one side, you get, more free radical formation, and that causes mitochondrial problems, and people age quicker. I don't know if you've ever noticed, but between 25 and 35 years old, all you had was birthdays. You didn't really age more, did you? And it wasn't until the point where you stopped using oxygen that you started feeling like you're getting old, right? And it happens at a different time for everybody based on their environment and their genetics and a bunch of things. But so when on the other side is when we have decreased buffering of these free radicals. I mean, it's normal to make these. When we don't buffer them as well, we start getting all these degenerative illnesses like arthritis and hypertension and accelerated aging and such. So pop quiz, are free radicals bad? No, only if they're not controlled, right? And what controls these free radicals? It's the antioxidant enzymes in our bodies. Of course, vitamin C and vitamin A and E and glutathione and stuff, but we have enzymes inside of our body that are made to do the heavy lifting: superoxide dismutase and catalase. And this is where ozone really shines. because it stimulates this. Now, ozone is not the panacea of treatments, although you can use it for almost anything, but it needs to be in conjunction with a healthy diet and other healthy detox and hormones, and illuminate, some of the things that are contributing, right? And of course, we need to consider like caffeine and alcohol and stress and other things, right? But it is a fundamental part of our treatment plan. Now, back in 1920, this guy was quoted, Mr. Arndt Schultz, who said, for every substance, small doses stimulate and moderate doses inhibit, and then large doses kill, right? And we think, all you got to do is, drink too much coffee or tequila and realize, well, it's the dose that becomes poisonous and having adverse effects, right? And so what we know is that ozone stimulates the plasma, and then you get these reactive oxygen species. And so in your blood cells, these are the rapid onset. The blood cells, your red blood cells immediately bring more oxygen to things, and we activate the immune system, the leukocytes, and then the platelets stimulate all these growth factors, right? So this is what happens immediately, and there's tons of data to show this. But then during the exposure, afterwards, what happens? What's really interesting is the endothelium, the inside lining of the blood vessels, you get this increased release of nitric oxide, which is it's considered another hormone now, right? But this is the benefits of vasodilation and improved circulation to the body's tissues. We actually see that bone marrow, we stimulate stem cell activity in the bone marrow, and then we have upregulation of these oxidative stress proteins in your organs. So we get this super healthy response. And so when I tell my patients, hey, you should do ozone autohemotherapy, it's because it works in so many ways to get your body moving again, right? To kick off the rust and get started. So what was really interesting was in 96. So think of this, back in the 60s, they figured out how to do autohemotherapy, right? That's a long time ago, okay? And, they were really figuring out the doses and such. And so it wasn't until the 90s that it's a toxicology principle, it's called hormesis, where there's a beneficial effect of a low-level exposure to something, but if you were to give a lot more, it's not good. Kind of like when you stretch a rubber band, it works pretty good, and then, oops, I broke it, right? And so this happens in our body too. So ozone autohemotherapy works really well. Now we're going to move on to, so what about some of these toxins? Okay, so the governmental agencies are very siloed. We know this, right? There's diabetes organizations and public health organizations and cardiology and OBGYN. There's all these different things. And the EPA and the FDA and the CDC and all the state health departments have all recognized that there's global chronic low-level metal toxicity issues. And it's not a secret, right? Now I'm going to just skim through a bunch of these slides because I want it to sink in that there's this massive volume of stuff that we're getting exposed to. And it's easy to think it's not happening and be an ostrich and put your head in the sand. But the truth is it's a massive, we're missing something here. Okay, so something turned on somewhere. So, okay, we get aluminum from all over the place. And what does aluminum do? Well, it causes a lot of problems for some people, right? Are we able to get rid of a certain toxin or not? That's a good question. And I can't tell you unless we do some chelation studies on you. What about arsenic? It's everywhere. Your rice, your pesticides, metals, herbicides. And what does that do? It causes all kinds of cancer, right? And then, but it doesn't just cause cancer, right? It causes these infirmities, whether it's lung irritation or, why does this person have low, anemia or darkening of their skin or all kinds of things? What about cadmium? Also everywhere, right? And then, well, it can make people feel sick. It can cause kidney disease, different cancers, right? I thought this was interesting. We have a plague of fertility problems right now, don't we? I mean, everybody we know, somebody who's had a hard time having a baby. And this may be the xenoestrogens and the microplastics or but cadmium has been clearly proven to affect sperm quality, count, motility. And so frequently we will use chelation therapy to evaluate young men and chelate them. And we've had several families who have had some success just because of clearing out their body. So mercury is another one. It's everywhere. We partner with the biological dentists quite often. And I just had several patients in the last few days who come in and they're getting their amalgam fillings removed and they want a strategy, right? And there's certainly some, chelation therapies that we can offer to help them. Mercury toxicity, again, aluminum links to Alzheimer's disease. I don't think this is new for many people. Lead is a big one, right? Whether it's, lead in the water in Flint or lead in our protein powders if you get cheap stuff. So all over the place. More health conditions associated with lead, right? Nickel. Okay. What was really interesting is, I don't think I have the date on here, but this is a published textbook that was showing that there was a 90% reduction in cancer mortality by chelating these patients, by removing the toxic burden of metals that are causing oxidative stress. And then here's a nice concise table showing, if you have cancer, where should we go hunting for it? We do a lot of functional testing. I think functional medicine is, I think it's good medicine, right? And I think it's gone from maybe fringe ideas to really the future of how we should be treating our patients. I oftentimes work with our medical nutritionists on looking at microbiome or food sensitivities and such. Here's just some examples. We do nutrient analysis with organic acids. Here's some great examples of chelation testing where we have pre and post chelation. And really the idea, one of the take-home ideas with chelation is, like for the example of aluminum here up at the top, this person, they pee out all of their aluminum. And so this is the post chelation. After they've chelated, this person doesn't have any aluminum left in their body. So they don't have an aluminum problem, right? Whereas, when you go back to this lead and mercury down here, you see, oh yeah, you are excreting some, but look at that. After chelation, we see that there's this huge reservoir in their body, and we won't know what your problem is until we test you. So I hope this is a good, just kind of overview of what it is we do as a team, right? To talk about things like what you eat and how you eat it, and what's the strategy for timing, and are we thinking about what's going on in your body? And so there's testing for that. There's things that don't really cost a lot of money, like fasting or sweating, right? I think we need to agree that food and exercise are the best medicines for people. But when people are stuck, there's a medical strategy that's more advanced, and it's about energizing your body to do more of what it was supposed to do, not just putting Band-Aids on it, but then also removing things that are really sticking up the gears and interfering with health. So I'd like to maybe stop here, and if there's any questions, do we have any questions?
You can ask on the webinar as well.
Are there any questions on the webinar? I don't see any attendees.
I'll see.
Okay.
Yeah, we have a question.
I have kind of a funny question.
Yeah.
Talking about sweating.
Yes.
So if a woman has terrible menopause symptoms and is sweating and night sweat, is that detoxing at the same time as you're studying night classes?
You know what? I think.
Dr. Bush, sorry to interrupt. Can we repeat the question?
I'll repeat the question. Yes. Let me go ahead. I want to share the screen and go back to the question was, if I'm having menopause problems, and I don't want to share that. Excuse me. I want to go to the slideshow. There we go. There. All right. If I'm having menopause sweats, does that count as detox? Sweating is sweating, right? you're getting rid of your body. So I think menopause sweats are uncomfortable. And I think there's plenty of data to show that we would want to, restore hormones to youthful levels because there's brain benefits and, osteoporosis benefits and other benefits, based on the hormone. But to answer your question, I think sweating is sweating and that's a detox.
I'm joking.
Any other great questions?
When it comes to heavy metal chelation, there's a few ways that one can go about it. There's some camps that say doing low dose oral chelation, low in soil is a good way to go. Things like DMSA, alpha-lipoic acid on the light. And then there's also IV chelation, which you can use with ETA, sometimes even TMPS. How do you know what kind of heavy metal chelation to save this patient? How fit these toxins out of it?
That's a great question. I'm going to repeat it. So the question was, there are many types of chelators, DMPS, alpha-lipoic acid, DMSA, and EDTA are some of them. Deferoxamine's another one, and there's other ones for copper. So really it's looking at the affinity of the chelator for specific metals. Those are ranked, right? So if we were going after mercury alone as like the most important thing in the world, and we also want to think about, so not only the metal that we're going after, but also, looking at this to say, is this an emergency? Is this urgent? Or is this just kind of important, right? I was an ER doctor, and so we would have little kids come in vomiting and stuff. And but like summertime was always an interesting thing. I was, would work in the Midwest, and you'd see a little kid and they come in vomiting, and you're like, I'm gonna get an X-ray on this one, and you're like, oh my gosh, there's a bunch of dead sinkers, right, in this kid's belly, and so this kid has a medical emergency from acute lead toxicity, right? And so like EDTA is an IV, medication that has like high affinity for lead. So we call up GI, have them go get the sinkers, take them out, and then, admit this kid to the hospital for aggressive IV chelation. Okay. But chelation is one of these things where you kind of throw the baby out with the bathwater, right? Like these chelators have affinities for like good metals like zinc and magnesium also, right? So while there is a very American idea of like more is better, right? What we know is that we want to have pulse chelation, and then because it pulls out a lot of minerals,
Concentration.
and then to stop and replace. So we actually have strategies. There's a lot of different strategies. Low and slow can get people into trouble, right? Because they continuously will be taking DMSA, or they buy some Quicksilver EDTA and they chelate themselves for 2 months, and then they come in and their thyroid is completely messed up because they've depleted their body of all the selenium and zinc and all these other cofactors that you need. And so I don't recommend long-term chelation. I think pulsing it with measured, what are we taking out, what are we putting back in, is probably the safest. I think there's also it's important to monitor kidney function, right? And liver function, right? Because you're putting a big load. And so really we pay attention. I mention this a lot about paying attention to the soil, right? Like if you're going to be planting seeds, you really got to pay attention to the soil before you do things. And so we really have to make sure we're paying attention to detox pathways and liver function, kidney function, and teeing somebody up for success instead of just getting started willy-nilly and then you hurt somebody. Does that make sense?
Yeah.
And so I think it's a case-by-case basis, and so that's why we'll do a chelation screening on people with a medium-sized dose that's decent and not going to hurt like 99% of the population, right? And then we do have some children who come in, and so we of course use a measured dose, but that's where finding individualized plans for each person, which is really our mantra, is to treat each person as their own plan, and no two patients have the same plan.
And then quick piggyback question. Yeah. At your clinic, do you like doing a provoked heavy metal urine test with chelators? Do you like doing a hair and mineral analysis test, or do you like doing like a quicksilver tri test? There's a few different ways to test.
We do pre and post chelation provocative testing with IV EDTA 1500 milligrams, 500 milligrams of DMPS, and we add potassium citrate to alkalinize the urine. So the reason we do that is because we can then see the provocative net cumulative load, right? The cumulative retention within the patient. And then you also have a measurable concentration. It's a 6-hour collection. And then you take people through however many rounds of chelation, whatever that is for them. And then we then have a number, right, of a concentration based on excretion, which I think is a pretty standardized way as far as, I became chelation certified through American College for Advancement of Medicine, and they have the only chelation program that I know of in the country. And so most of us are using the same kind of way as far as physicians. Great question, sir. Yeah. Anybody else? Ozone, anything else?
When your associate was talking about anchors pulling toxins out of the body, is that through eating different correct foods, or how does that work?
Can you clarify?
He was speaking about anchors in the body pulling toxins out of the body after they're radicalized. How does that process happen?
Satya, do you want to maybe come up and repeat the question, and then he's on his way. Yeah, I honestly, if I can just take a moment while he's coming up, it has been a marvelous pleasure to work. Medicine's a team sport, right? And so to be able to work with such talented and smart professionals, I learn something every day from them. And so, like even today before this, I was saying, you know what, I want to phone a friend because I don't know that. And so I like to practice intellectual humility, and I just want to make sure we, give credit where it's deserved. Why don't you, he just had a question about what you said.
Yeah, and I was using a metaphor with anchors. Once phase one mobilizes toxin, and remember that it becomes more dangerous to the body when it's in the water soluble mode, they pull it out of storage, phase one, that is the liver. You want to have phase two engage, and there are different foods, different nutrients, different herbs that do engage phase two and phase one in the liver. So it becomes this individual approach. So I'm a big fan of getting a lot of good lab data when we're doing something like this so that I can see it. I've had to work intuitively with clinical intuition, and yeah, things can happen, but it's amazing, these new lab tests now. So yes, you can. And to give you an example and of things that can help with phase two liver detox, there's things like ginger, turmeric. And how would you employ these? There's also cruciferous vegetables. There are different levels depending on which ones we're talking about. Different ways of consuming them to achieve more benefit depending on which of the cruciferous vegetables they are, for example. And there are nutrients, and it is also necessary to deactivate some of the toxic reaction of these chemicals. There's also the glutathione system in the liver, which we know how to actively engage through direct provocation. There's also I really like using, for instance, NAC for getting glutathione going, and depending on what's going on, there's a lot of different things that we can do individually for each person, depending on where they're having the struggles. And as a last thought on that, food sensitivities, the inflammation that they create in the body is profound. And so this becomes something that's related to things that we ingest every day. And when you're ingesting something every day, that has some effect on your body. This also becomes part of what we're looking to cleanse out of the body. The microbiome, think of that. You can have, let's say you have a problem with digestion that you didn't really know of. Maybe it's with digesting fats or protein for different reasons. But just digestion wanes for different reasons related to illness, related to age. And as this happens and you're not digesting, your body is unable to pass in single molecule form through the intestinal filter. And so we get damage to the filter, we get overpopulation, overabundance. What is above is reflected below. So often when somebody has had some of these problems with digestion, I go in there to look at how we can improve digestion. We need to remove the foods so the immune system is not memorizing and pegging and instigating these TNF alphas, the IL-6s, which cause massive inflammation every time they do. We need to get rid of these. And then we need to rebalance below so that things aren't imbalanced. So there's the more in-depth answer on that. Thank you. It's a great question.
I just
Yes.
have one more quick question. I know some clinics, like when people are dealing with toxin overload, one of the rising stars is methylene. How it can actually get into the mitochondria to heal. Is there anybody can talk about this? How do you guys get rid of methylene blue and do you use it?
I'll let the doc talk about it. We were just talking about it recently.
So the question was methylene blue. Fascinating molecule. It's the oldest drug we have, right? 1800s. Methylene blue is, a medical dye, but we also know that it works at the mitochondrial level. I think it's the cytochrome 1 to 3. Basically shake hands because it's an electron donor and acceptor. Really cool molecule. And so it's an interesting way to increase energy production to rescue people. Now, certainly I was trained to use methylene blue in cases like cyanide toxicity, right? We have a person actively dying and you rescue their mitochondria, right? So I only gave it a couple times in house fire patients. But it's something that we actually always have on hand because we get people showing up and they are sick. And I'm like, holy crap. You're not making very much energy at all. And so we've actually rescued a couple of people with IV methylene blue here in our clinic. We prescribe it, I want to say almost every day, but we use a lot of oral. Many people find that there's cognitive enhancement, kind of like a limitless drug feel. People really enjoy methylene blue. It's also photoactive. So this whole we didn't really talk about photobiomodulation, but this idea that we can use different wavelengths and light energy to activate whether it's immune system or even pharma compounds. So methylene blue is photoactive, and so we do give oral methylene blue, and we have light therapies, but then we even have IV therapies where we'll give people IV drips and activate the methylene blue on the way in. So I can tell you to do your homework. That's simple stuff. Oh, that's great. Yeah. Anybody else?
I'm going to ask about niacin with these far infrared saunas where you titrate. Any experience with that?
The question was on titrating niacin, high doses of niacin with regard to infrared saunas.
In conjunction with far infrared sauna to detox.
So I think what you're referring to is niacin's role. Niacin is B3, okay, and so niacin is also a precursor to NAD. Okay, so people use NMN and NR, these other things that are precursors to NAD, but my understanding is when you take these that you actually just break them down in your stomach, and your body still has to put it back together to make niacin in the blood. So the reason people use niacin, high dose niacin, is to stimulate energy production, and using it, the Hubbard method, is in conjunction with infrared to increase sauning, right? So people get this flush, right? Or when we have a vitamin here called Supermoon Quick Start, and almost everybody starts out with itching, and you feel whoa, this is the strongest multi I've had in forever, and it's noticeable. So this flushing that you get is increased energy production in the cells, and using that in conjunction with infrared is an interesting way. People also will do like fever therapy, right? Mistletoe is a great example. Or we even had a patient who went to Europe and was intubated and given full anesthesia, and then they brought her to a core temperature of 106. Right, and so people, this is like a Lyme treatment that they were doing in Germany. So there's a lot of different approaches, and I think there's scientific merit to all of them. It's just a safety aspect of what you're willing to do. That makes sense? Yeah.
Was wanting to try it and was kind of always maybe afraid of that flushing symptom. I mean, they're supposed to titrate up, but
I think titrating up on niacin based on your symptoms is reasonable, but then also to you could probably play with it, and I don't think you'd hurt yourself. There's other more dangerous things that I would be more worried about. Another question.
One last one.
These are all great questions. I mean, we have a lot of people here, and I think
You guys did a good job touching on the benefits of ozone. How do you guys feel about also using hyperbaric oxygen chamber therapy, especially more of the hard-sided ones at higher atmospheres, to really get to those deep-rooted infections? Is that something you do, or how can we recommend how, or raw?
That's a great question. The question was on hyperbaric oxygen. I think it deserves a nuanced answer, right? Hyperbaric oxygen is a great tool for increasing the delivery of oxygen to tissues along a gradient, right? The caveat is, and this goes for like rectal ozone as well, is that some of our most beneficial microbiome bacteria are like anaerobes. So like, there's a lot of people who are like, rectal ozone is so inexpensive and it's easy to give people, but you like destroy your anaerobes in your colon. Okay. And so when we think about somebody who may have leaky gut and we're like pushing oxygen at high pressures, you could be affecting their microbiome, which is arguably consequential, right? And then where was it? There was just an explosion in somebody's hyperbaric tank. It was like this week.
The 6-year-old boy was killed.
Yeah. So it's not benign, okay? And if done inappropriately, people can get really sick.
I guess a better question is, when would it be a good time to use it, and when would not be?
So now, right? So like acute carbon monoxide poisoning, I've sent a lot of people to dive, who are in fires and such, and I think there's some like established guidelines for like chronic diabetic wounds. The rest of it, in all honesty, is people who have a tool and they're looking for an application for it. And so we're still in the investigative phase. I don't think all of the data is convincing. I think, there's altitude research and diving people, when like for diving accidents and such. There's a trend towards good data, needing like 1.6 to 1.8 atmospheres for head injury patients. And I know that's something that I'd be willing to do. I actually had somebody try to give me a hyperbaric tank. Well, sell me one for really cheap. I mean, it was a soft-sided one that could go up to 1.8. I chose not to take one here because it's a risk. It takes a lot of personnel. It's a lot of time. And then you're trying to sell another tool that has conflicting data. I think there's benefit, but when we're talking about like difficult to reach infections, I think ozone works great, right? Autohemotherapy systemically, with and really, you want to think about like the doses. Do you really need high doses, right? Because low dose ozone is immune modulatory, right? And it wouldn't be until, you could use photobioactivation and infrared and methylene blue, and there's a lot of other things we can do without subjecting somebody to these large atmospheric shifts that have potential consequences that are maybe unintended. Does that make sense?
It does. Yeah,
Yeah.
it seems like some camps they love it, some camps they just gave a good answer. They have their reservations, so it's always good to get that feedback.
You know, what we're trying to do here is to create a safe environment for proven therapies that people can explore and get access to. And so there's got to be a safety margin built in, right? And I think that's where we're really trying to create a space where it's above reproach. There's no snake oil feel to it. And that's one of the ones where I see the benefit in certain circumstances, but I don't think it's ready for prime time. And I'd be happy to have, I know there's lots of people who feel very strongly, and I'm like, yes, I understand that. But I also think, you know, when you need to do something 30, 40, 50 times to somebody, that doesn't sound super effective. Right? It seems like incremental, minimal value.
One of the reasons I ask is I come from a military background, and one of the modalities that seems to work with PTSD is that lower level hyperbaric oxygen chamber over the alternatives of drugs and ketamine and medications, since the VA wants to drug more of the veterans rather than let them use the holistic therapies.
His follow-up comment, which is a very valid one, was talking about the use of hyperbarics as a therapy for PTSD treatment at the VA. I happen to have some educated thoughts on this. I've completed a neuroendocrine certification in traumatic brain injury. So I think, and I was recently trained. I'm the only other provider in Colorado who has a patented procedure for intranasal plasma for TBI as well. I think there's some really good treatments. And the idea is to improve oxygen utilization in the brain to increase energy, right? What we know is neuroinflammation causes decreased oxygen utilization, which causes a lot of the secondary injuries and tertiary injuries after TBI. I have a whole nother TBI lecture that I give to physicians. You may be interested. And what we need is the energy production. This ATP is, when we think about it, the hormone receptors are 100% energy dependent, as are all of the genetic DNA repair enzymes, right? So the whole process needs fuel, right? And what they're trying to do is push more fuel into a boggy, inflamed environment with the hope that it would like kickstart things and get it better. But what we know is that a lot of the neuropsychiatric syndrome associated with PTSD, right, is really related to pituitary dysfunction, right? And so the pituitary gland is a small gland that gets injured in trauma. And so there's the four main hallmark symptoms are cortisol problems, right? Thyroid problems, growth hormone problems, and then the sex hormones, right? So these are really the four areas where neuroendocrine research. I was invited to go to Ukraine and to Australia recently to be a physician helping to teach. I've got kids and I got a growing medical practice. I couldn't go, but I was invited, to go to Ukraine and help, they got hundreds of thousands of, head injury patients, right? We have a bunch of them here, and we have dozens of veterans who had concussive blast injuries and such. So yeah, I think there's a role again, but there's so much data showing that the other stuff works too, and treating neuroinflammation and affecting neurosteroids is an easy thing to get people better.
And if the pituitary gland was one of those that was assaulted, what other modalities of treatments and detoxification do you like for that?
I think I just mentioned, we have a group. The question was, so if somebody has pituitary, either in part or pan-pituitary hormonal imbalances, what other therapies do we do? So first is to treat neuroinflammation. Second is to balance their hormones. Third, we do intranasal plasma. And fourth, I've got a gyrostim right over there that stimulates neuroplasticity. So we use a multi-prong approach. And honestly, you know, it's been tremendous to see people heal their brain. I actually just uploaded the video of one of our patients who had severe brain fog, incapacitating, like, boy, am I glad I can still keep my job, kinda, right? And then she had massive improvement with intranasal plasma, a bunch of the supplements and hormone balancing, and then we did intranasal stem cells. And she's like, holy crap, I'm back, right? And so that kind of stuff works. We have a stroke patient that we're going to see on Friday, getting intranasal plasma and stem cells and IV stem cells. So this is the good stuff. Any other questions?
I have one, and I think Satya and Nikki, I'd love to hear your thoughts on this too. So I want to be 32, and in my generation, and there's so much content. And I hear this from friends who nutritionists, or they try different protocols, and it seems to vary. They hear, oh, you need to try fasting, or you need to stick to this one thing. And it's overwhelming in a lot of ways. And I think oftentimes we're talking about very, very premier science that a lot of people don't really know about. So if you were to have someone who's 31 trying to lose weight or just feel better as a whole, and they ask you, what can I do exercise-wise? What would I do nutrition-wise? And they want a simple answer, even though it's not simple, because it all depends on their body, right? How do you handle that kind of question?
It's such a good question. And the question is, you know, for someone who's looking to optimize, but there's so much information out there, whether it's on the internet or through friends and family or whomever you might be speaking with, where do you start? Essentially, is that kind of the question?
Because it is overwhelming.
It is overwhelming.
Do I fast, or do I go for high intensity workouts? Do I sprint, or is walking enough? Do I lift the weights? How does that work?
I think first, yes, it's going to be individual. I think in my mind, for someone like you, who you're truly looking to optimize. Now, I don't know anything about, you know, if you have any kind of symptoms or whatever the case may be, but looking to optimize, really taking it to basics, right? So the VO2, there you go. Yeah. Yep. Do VO2. But, you know, we need weight training. If we're looking at exercising, we need weight training at every age. I've had a client came to me and she said that she was excited because she was up to 10 pounds in her dumbbells. She said, but I don't want to go to 15 because I don't want to bulk up. It's like, you're not going to bulk up. I said, and I tell everybody this, I want you to lift as heavy as you can and not hurt yourself, right? Because it's the muscle mass that helps to keep us heavy. It's the muscle mass that helps to create healthy bones. It's the muscle mass that helps with cognitive function, right? So we need the muscle mass. When it comes to food, if we're going to make it super basic, fruits, vegetables, meat, fat, right? The things that are going to be sort of on the, you know, the fringe a little bit are going to be grains. Do we actually need grains? Do we actually need legumes, right? Some people can handle them, some people can't. And so those are super basic. Hydration, and, you know, knowing your body, you know, what can your body do? If you're having symptoms, just know it's your body talking to you. And, you know, we tend to want to brush it off or blame it on age or blame it on bad luck or blame it on genetics, when if we just sit back and say, okay, whatever this is that I'm experiencing, it's not great, don't really like it. It's the body saying, knocking on that door. Like, hey, I need your help with this now because it's already gone through all of the things it knows to go through. So it now needs you to jump in and say, okay, I'm going to now start to figure out what that looks like. And so can you do it before you start having symptoms? So that's when, you know, we have these really cool tests for optimization, right? We can look at the gut microbiome. We can look at inflammatory markers. We can look at, you know, the food sensitivities and hormones. I mean, the amazing, and you, Satya said this already, the amazing things that we can find just are understand about our bodies doing genetic testing and epigenetic testing. These are the coolest things in the world that help us to pinpoint, this is my body. I now know my body. This is what I need. It's not what everybody else needs. And this is how I can address my health for today and for the rest of my life. And what's even better than that, where I nerd out, is this is if you know, you're your age, if you are married and looking to have children, you have the ability to impact generations ahead. So it's up to those of us who, I'm not one of those, but those of us who are, excuse me, are looking to have families or grow our families, knowing that the choices that I'm making today can create the health of the future. Like, it's up to me. It's up to you, right? It's the best thing is I am accountable for my health and I am accountable for this part of the future. It's fascinating stuff. Probably went way outside of what you were asking, but.
No, that was exactly what I was hoping to do.
Okay, good.
And it's complicated and it can seem overwhelming.
Very much so.
Scary.
Mhm.
But it truly is about you. And I
Yeah.
appreciate that
Mhm.
a lot. And I think it's scary. And there's so much misinformation.
So much.
Right?
Mhm. There is. You know, it's the fad diets. It's the let's try this therapy or that therapy. And, you know, what is it? If we're not taking the full body, the full person into consideration, history of trauma, right? You know, these are things, his familial history of trauma. These things can impact us today.
Epigenetics.
Yeah. So it's the epigenetics.
I think if I were to give an answer, what we tried to do was to create like a retail option. And I think VO2 testing is a great one because, you know, to use pretty settled science, right? It's been the gold standard for 100 years, where we, you know, measure your oxygen, CO2 in addition to heart rate, and then take you through your paces. We get your resting metabolic rate. You get prescribed exercise heart rate zones with an exercise physiologist. And then there's a great way to get started with a AI and nutrition-based nutrition plan, okay? Where, you know, and there's an app with a scanner, you know, for like WhatsApp. I mean, this is like a modern version, right? Where to get people started. And so, you know, for not that much money, people can come in and, you know, we have a string of people just coming in for VO2 testing, whether they're athletes or people who just, you know, want a little, you know, understanding of what heart rate should I be exercising so I can lose weight better, right? And I think something as simple as that, some costs a couple $100, and you get, you know, a year's worth of great advice on your metabolism, would be another thing that I'd recommend. Does that make sense?
Yeah. Thank you. It's really helpful.
Cool. Any other questions, guys? We're going to wrap it up. We're going to do our raffle. So to the online folks, we have a bunch of people here and we are going to raffle off a prize. So you're missing out. And we will be posting the 14-day detox plan, and we'll send that out, and we're launching a new detox website, just kind of clarifying a bunch of the strategies that we have. And we thank you for joining us online, and we're going to do our raffle. So we're signing off.